Welcome everybody. My name is Dr. David Ginsberg and I consider myself a health coach. My mission with these Body Signals lectures is to share my knowledge to help improve the health of the Tri-City area. So thank you for checking in online and helping me to fulfill my mission. If you enjoy this workshop, please refer others to the website or YouTube page where you watch this. So what we're going to talk about today is what we call falling apart syndrome, hips, knees, and lower extremity workshop. Before we get into that, I want to tell you a little bit about myself and why I became a chiropractor. When I was in high school, I was a tennis player. Tennis was my life. My doubles partners and I were one of the top-ranked teams in the state of Illinois. And during my junior year, I developed some sciatica, pain going down my leg. I didn't want to take any time off, and I knew if I went to my family doctor, he would tell me to rest and take a few weeks off and maybe take some ibuprofen or something stronger. Well, my sister was about to start chiropractic college, and she referred me to a chiropractor. This chiropractor told me about my spine and how my hips were out of alignment, making one leg shorter than the other, and how the vertebra was twisting and putting pressure on my sciatic nerve. After a couple of weeks of adjustments, I started to feel really good, didn't have to take any time off, and my doubles partner and I ended up finishing in the top 12 in the state of Illinois. Some people, I believe, are born to do certain things, and I believe I was born to be a chiropractor and help improve people's health by educating them about how their body works. So enough about me. Let's get on to lower extremity injuries, how to prevent them. If you or someone that you love is struggling with symptoms of a lower extremity issue, for example, you have a hip, knee, ankle, or a foot problem, then you're in the right place. We're going to get to the bottom of these common issues. You're going to understand the real cause of these problems, and most importantly, what you can do to avoid these problems and/or to correct the issues and get back to life. Today we're going to focus on some of the most common lower extremity issues: hip and lower back pain, knee pain, leg pain, ankle problems, and foot issues like plantar fasciitis and Achilles tendonitis, or what we lovingly refer to as adult onset falling apart syndrome. So here's what we know. Body Signals program, we talk about condition-specific solutions. Symptoms, things like hip pain, knee pain, ankle problems, or foot issues, they're all symptoms. Numbness, tingling, weakness, these are symptoms. And what are symptoms? They're communications from your body trying to tell you something. What is your body trying to tell you? It's trying to tell you that there's a problem, there's a breakdown, there's a stress that your body can't adapt to. The tissue is breaking down, or you're moving away from health. You're in trouble, and you need to address it. You need to make a change. So let me ask you this. Is this a smart warning system or what? Is your body smart or stupid? Well, of course, it's smart. We know our body's smart, and we know it's trying to tell us something with symptoms. So that's why we refer to symptoms as body signals. Here's the key. How you interpret and respond to your body signals is what makes all the difference. Do you listen to them, respond and make changes, stop damaging your body and start healing your body? Or do you try to ignore them and just press on? Maybe it'll go away, or maybe it's just part of aging, or just telling yourself these are normal aches and pains, or other stories we tell ourselves. Or worse, do you try to stifle these warning signs with drugs? Dangerous chemicals that only suppress your body's communications so that you feel better temporarily while your problem continues to get worse. Is that smart or stupid? So who's ready to learn a better way? Symptoms are the tip of the iceberg. The way that you think about symptoms drives your choices, which drives your outcomes. This is critical because if you only worry about treating the tip of the iceberg, you're ignoring the underlying cause. Okay, So let's talk about symptoms. What do symptoms really say about your health? So this is what I like to call the illness-wellness continuum. Where do you fall on this paradigm of illness or wellness? Are you moving towards health and wellness, or are you moving towards sickness and death? At what velocity are you moving towards health or away from it? After all, momentum is mass times velocity. Understanding symptoms or body signals means that you understand the alarms and what's happening. You want to learn how to speak body. You also need to know that our body has an inborn or innate intelligence. It has the ability to heal itself when it's given the right tools and if there's no interference. Making better decisions leads to better choices or behaviors. What's your objective? Temporary symptom relief or to regain your health and your function? So the way that you think or your belief system organizes your behaviors or your choices, which leads to your outcomes or your results. Now this takes us back to what I call our current health crisis. And there's 3 reasons that we have a health crisis in the country. The first reason is that most people don't take responsibility for their health. Who's responsible for your health? Is it your wife, your brother-in-law, your doctor, your insurance company? No, it's actually you. Well, the second reason that we have such a health crisis in this country is that people are taught that symptoms are the best indicator of health. Now, really, most of us know that's probably. So feeling versus function. There's actually 3 parts to your central nervous system. There's motor nerves, autonomic nerves, and sensory nerves. What this means is that only the sensory nerves, or only about 1/3 of the nerves in your body, carry pain sensation. So many of the other things that are going on inside your body happen without pain or obvious symptoms. And the most common symptom of a subluxation is actually no symptom at all. And we'll talk about what that is later on. This is true for most common health issues though, by the way. For example, what are the symptoms of heart disease, diabetes, or cancer? What does that feel like? By the time you feel these things, are you in big trouble or are you in huge trouble? Even the most ubiquitous health problems like tooth decay, by the time you have symptoms with most dental issues, there's an issue or there's a problem. And this early sign or a late sign that you have a health problem. So why are we taught to judge our health and maintain or manage our health by symptoms? It doesn't really make sense, does it? Okay, so let's take a look here at our lumbar spine and our pelvis. It's made up, the lumbar spine is 5 individual joints, and there's nerves that come out, and those nerves run down the legs, the back and the front, to the muscles and the other soft tissues, into the lower leg and into the feet. We also have the big bones of our pelvis that make up our sacroiliac joint, and there's nerves that exit there as well that go out to the hips, down to the knees. Everything from the foot up, when the feet are on the ground, is called a closed kinetic chain. Every step that you take, the forces that come up from the ground go into the foot, then the ankle, shin, knee, hips, and then into the lumbar spine, and even all the way up into the head and the cheeks. Downstream symptoms or body signals can occur from upstream problems like subluxations. Or they can occur from problems in the feet, knees, or even hips being subluxated or out of alignment. Take hip problems, for example. Joints or structural systems work together in complex movement patterns, which means that as your hip connects into the ilium, it's got to move freely within the socket, but then the ilium has to move freely on the sacrum, and the sacrum has to move freely on the lumbar spine or the lumbosacral joint. They all work together. And this starts again with your foot hitting the ground and it moving properly. So the lumbar spine, the SI joints, the hip joints, all the way up have an effect on the entire kinetic chain. Walking and running are both dynamic activities, and they actually they actually differ quite a bit. So as we talk about falling apart syndrome, lower extremity issues, we want to first address a subluxation. And if you refer to the upper right part of the slide screen, subluxation is a joint misalignment that causes some soft tissue damage, resulting in inflammation and nerve irritation as it exits. It's also often accompanied by muscle spasm in the area, loss of imbibition, which means that the discs in between the spine, they start to lose fluid. And over time, that causes degenerative arthritis or wear and tear arthritis. All of the above causes joint fixation, meaning the joint doesn't move properly in one direction or another. Again, I haven't said anything about pain yet. And the longer this joint stays fixed, it starts to wear out faster. And that's because we don't get nutrition pumped into the joint or the discs, and we don't get waste pumped out. That only occurs by the individual movement of each joint. And remember, when it subluxates, which can do without any pain, you lose that normal flow of nutrients in and waste out, or that loss of imbibition. This leads to arthritis. Now, if we take a look at the screen that says SI joint subluxation, you can see how that's off to the side. And the SI joint is made up of the ilium and the sacrum where it comes together. This is super common. And one of the biggest things that happens is sometimes just stepping in a hole or stepping off a curb without realizing it can jam the SI joint and cause it to misalign forwards or backwards. This will cause a breakdown of the gait mechanics because as you're moving your feet forward with a walk or a run, the sacroiliac joint or the ilium on that side has to move forwards and backwards on the sacrum. When you lose that normal mechanics or normal rotation, you start to get compensation from the lumbar spine, which can cause wear and tear arthritis. You also start to get compensation at the hip joint itself, which can lead to degenerative arthritis of the hip, resulting in needing a hip replacement. One of the other compensations that often occurs is now the knee and the ankle and the foot have to try to move differently. So as I said, subluxation. How do you get these things? They can occur from macro or micro trauma, which causes damage to the spine and connective tissues. The ligaments that hold the bones in place allow them to move but not too far. They get stretched out. When that happens, the joint misaligns. Then it puts more stress on the surrounding muscles and tendons, which become spasmed or inflamed. This can also happen in the extremities. This can occur for people who sit and drive to work every day. Their hamstrings and their hip flexor muscles become shortened from the chronic sitting. Their discs become inflamed because other than lifting, sitting puts the most pressure on a lumbar disc. As I described earlier, more significant trauma, slips and falls, or even tiny minimal trauma like stepping off a curve can create stress on the nervous system and interfere in the communication of the nerves that exit between the SI joints or the lumbar spine. Those nerves communicate with the brain and they go down the leg and into the foot. The change in information or loss of communication going to and from the body and the brain now, as a result of the subluxation, starts to create symptoms over time. This interferes with healthy function and healing. This condition is known as a vertebral subluxation. Again, subluxation is joint misalignment, soft tissue damage, inflammation and nerve irritation, spasm in the area as protection, loss of imbibition, which is the nutrients flowing in and out of the discs, and eventually over time leads to degeneration due to long-standing joint fixation. One thing I didn't mention last time, in addition to that arthritis, when you have long-standing fixation or irritation, joint subluxation, This can lead to elevated stress hormones. So feeling stressed out, not coping with stress properly, anxiety, issues like that, even weight gain due to excess cortisol, all from a subluxation in the back or the hips. Okay, let's take a look at knee problems. Knee problems often stem from downstream issues from an SI joint subluxation. They can also be due to altered gait, which is sometimes caused by an SI joint subluxation, but it can also be caused by a short leg or foot pronation. This ends up putting increased stress on the front, back, or the sides of the knee, which leads to some wear and tear in the knee itself. Sometimes misalignments in the SI joint will cause it to rotate inward or outward, and this can cause the foot to turn in or out, which ends up putting excess stress on the inside or the outside of the knee. The other thing that can happen is it can cause valgus stress, which puts increased stress on the medial meniscus or the inside of the knee, leading to degenerative tears or sometimes. This slide is basically depicting what we call dynamic valgus. Notice on the x-ray, the one on the left, the joint space is equal. But you notice to the one on the right, on the inside of the knee, particularly where the red arrows are, there's a loss of joint space. This is due to degenerative arthritis. It's due to a wear and tear of the cartilage on the inside of the knee. Also, more specifically, a wear and tear of the medial meniscus. One of the most common cause of this is a valgus, or an internal stress on the inside of the knee, and this occurs from rotation of the ilium or the SI joint, or it can occur from pronation or a flattening of the medial arch of the foot. So as I said, that SI joint subluxation from above or the pronation from down below, it changes the gait. It turns the bones of the upper and lower leg, putting more stress on the inside of the knee, resulting in a medial meniscus problem from valgus stress. The opposite can happen as well when the ilium or the SI joint turns outward. You get the same kind of stress, except it happens on the outside of the knee. This will affect the lateral meniscus, which is the cartilage, or it can affect the lateral collateral ligaments. Okay, moving down the kinetic chain, we're getting to foot problems. Things like plantar fasciitis, metatarsalgia, and getting up into the ankles we'll get to next. Again, these can occur from an SI joint subluxation. It alters the gait, changes the way that the arch moves or holds itself. You can also have a pinched nerve from the lumbar spine, not just the SI joint, that affects the intrinsic muscles of the foot, leading to pronation or a collapsing of the medial arch. This causes the inside of the foot to flatten or invert. This is what normally helps us to absorb shock on the road when our foot hits the ground. As a compensation for somebody who is an overpronator, you will see wear and tear on the outside of the shoe, and you'll often see hammer or claw toes. Starting with the outside toes, they start to curl or reach for the ground because as your foot goes through that stance phase where it hits the ground, it's going to roll excessively to the inside, and the toes are going to actually leave the ground, so they actually start to reach or claw for the ground. This increased stress on the bottom of the foot or the soft tissues is what's called plantar fasciitis. If it ends up being more stress towards the ball of the foot, you may have a dropped metatarsal, or what we call metatarsalgia. And sometimes it can even lead to excess stress on the nerves that run between the toes, which results in what's called a Morton's neuroma. So we started out talking about foot issues, but again, it's really tough to talk about the foot without talking about the ankle. So if you have ever sprained an ankle, and you didn't rehab it properly, it's very, very possible that some of the bones in your foot or your ankle have actually shifted and remained locked out of position and that way. That compromises the way the joints of the foot actually move and makes your foot less flexible, so that every time your foot hits the ground when you walk, or the thousands of more times that it hits the ground when you run, you're going to have increased stress to the soft tissues in the foot, the ankle, and again, moving up the kinetic chain to the knee, hip, and lower back. When we look at ankle issues, look at the pictures on the left here, and you notice a pronated foot. See how the foot turns inward and it's flattened on the bottom or the inside of the foot. Again, a subluxated ilium or SI joint can cause a change in the leg length, often shortening or lengthening the leg, which usually leads to pronation on the short side. The center picture depicts the normal alignment of the Achilles tendon, which is connected to the calcaneus, the bottom bone of your foot there, and up into the muscles that make up the back of your lower leg, the calf, made up of the gastrocnemius and soleus muscle. And the opposite of foot pronation would be foot supination, where it's actually turned to the outside. This can also be a cause from subluxations of the SI joints as well. Some of the symptoms or side effects we see with pronated or supinated feet are hammer toes, bunion formation, metatarsalgia, dropped metatarsals, and Morton's neuroma. All of these caused by foot, ankle, or well, let's face it, growing old is not for sissies. But don't let them tell you that there's nothing you can do about it. Let's take some action. Success is reserved for the action takers. So who here is an action taker? Hopefully, because you're watching this, it tells me a little bit about yourself and that you are an action taker. So here are some things you can do to help prevent some of these issues. Self-care, foam rolling, particularly if you spend a lot of time walking or running. The muscles get buildup of lactic acid and other byproducts of exercise. To help clear them out, foam rolling is an excellent way to clear those tissues. And if you're participating in a half marathon or full marathon training program right now, I would suggest that you foam roll at least 3 to 5 days a week for about 10 minutes. You can refer to my website, www.kidchiro.com. Click on the YouTube link on the bottom, and then click on the foam rolling video, which will show you how to foam roll before, during, before or after you work out or have a competition, because there's actually different speeds or frequencies with which you want to do that. Foam rolling is simply a form of self-massage or self-myofascial relief. Foam rollers, rolling pins, the stick, trigger balls, lacrosse balls, tennis balls, they all work well depending on the area that you're trying to foam roll over. Stretching or exercise is also a good form of self-care. Again, if you're a runner, one of the most common causes of running injuries, and there are two main ones. One is biomechanical issues, which we've started to address, things like subluxations of the hips, knees, ankles, and feet. And the other is failure to build run-specific strength or flexibility. Doing specific running drills, doing exercises to strengthen the hip stabilizers like the glute medius and the glute maximus. Bridges, pelvic tilts, which you can also find on my website, are super good exercises for that. Clams and lateral lunges, also good for building up the hip abductors. Stretching exercises. If you commute or ride in your car for at least 20 minutes each way to work, you probably have shortened hip flexors or hamstrings. Or if you sit at work for more than a couple of hours a day. Concentrating on stretching the hamstrings and the hip flexors 3 to 5 times a week can go a long way in helping to prevent running and or walking injuries, or some of the things that we discussed earlier, falling apart syndrome, lower extremity injuries. And whenever you have soreness or swelling, you should put ice on the area. The next question is, should you seek professional care? If you've got a recurring ache or pain in the foot, knee, hip, ankle, or lower back, I mean something that comes back regularly, something that you've had for more than a couple of weeks, it's probably not going to go away by itself. And you're best to seek out professional care. Some of the things that can be done for these lower extremity injuries or issues, and for most of them, they don't require any rest at all. ART, or what we call active release therapy, which is a very specific type of massage. There's also regular massage therapy and instrument. Well, traditional medical care are allopathic options. Typically, they're going to recommend heat and bed rest. They're also going to recommend drugs. Sometimes they recommend physical therapy, which again generally addresses just the muscles. They'll also use things like steroid injections, pain management, and eventually surgery. Well, this goes for all injuries, and I want you to listen very closely. Particularly running injuries or any injury of the lower extremity. In almost every case, except for a stress fracture or Achilles tendonitis, you can continue to walk or run through the injury. And using drugs, steroids, or surgery is typically an expensive waste of time. And that comes from Lore of Running, which is like the Bible on all running injuries. It's a very, very comprehensive book. Until you get to the cause of the problem, like I said, things like drugs and surgery are an expensive waste of time. And also, rest is often not necessary, or I should say complete rest, for most of these injuries. So what about alternatives? What about looking at the wellness paradigm like we talked about earlier? Many people ask, Doc, should I take these drugs? Well, it depends on what you're trying to accomplish. Are you just going for symptom relief? Because if you are, then medication or drugs are probably the answer. But unfortunately, many times they end up prolonging the injury, particularly if a tendon's involved. Then things like ibuprofen or nonsteroidal anti-inflammatories, they actually prolong the tendon injury and create a tendinosis. If you're getting steroid injections, yes, they do decrease inflammation very well, but they also degrade the tissue. So that means they make it weaker and they make you more subject to future tears in those same tissues. So what is your goal and what is your outcome? A better question, instead of should I take these drugs, is what's causing my problem? Can it be corrected? How can I correct it? Well, you want to look at all the options, and you need to know what's the safety and what's the efficacy of the treatment that you're trying, short-term and long-term. With chiropractic care, we're looking to correct the cause of the problem. Here's what happens. We typically will look at your entire gait, starting with the foot and working our way up and looking at the ankle, knee, hip, and low back. We look at how it moves and how it relates to it, how they relate to each other in your standing posture, because it is a kinetic chain, and you can have issues that start from the top or the bottom. When you have a subluxation, as I said earlier, you can have joint misalignment, soft tissue damage, inflammation, and then nerve irritation. Typically, the muscles will start to go in spasm or compensate. You lose imbibition, or that fluid flow of nutrients in and out of the disc. This leads to joint fixation. And that fixation, as I said earlier, it puts pressure on the nerves. Those nerves, whatever's at the end of that nerve isn't going to work as well because the signal from the brain traveling down that nerve to that specific body part, be it your foot, be it your lower leg, your knee, or your hip muscle, that part is not going to work as well. And you're going to end up with problems, lower extremity issues, things like Achilles tendonitis, plantar fasciitis, metatarsalgia, meniscus issues with the knee, runner's knee, IT band syndrome, hip problems, degenerative joint problems in the hip, or sciatica. These can all be a result of subluxation. Well, how do you know if you have a subluxation? In our office, we use 5 objective criteria. And the only way you're going to know is if you get checked by a chiropractor. Here's our discovery process. We start out with a consultation, asking you about when did your problem occur. Remember, most running problems have 2 major issues: biomechanical issues or failure to build run-specific strength or flexibility. A third and less common issue is training problems, meaning over or under training. You started out too fast or you weren't conditioned properly for base training. So our history will give us an idea of which one of those things it may be. And if you're not a runner, if you played other sports or your symptoms of your foot, ankle, knee, or hip problem came up without you knowing how you injured it, we're going to try to identify that in our history. Then we'll do an evaluation, and what we're going to be looking for is changes in temperature along the spine that indicate that there's pressure on the nerves. We're going to do motion palpation. We're going to feel the individual joints of the spine, particularly the lower back and the hips, but we'll also check the movement of the knees and the ankles and the feet. And then we'll do static palpation, looking for signs of muscle spasm, swelling, nerve irritation, or just tenderness. We'll take a look at your static posture because how you move is absolutely affected by your posture. So if your static posture, your standing posture is weak, guess what? Your walking and your running posture is probably also going to be weak. And you're compensating somewhere along the kinetic chain for that. So we have to address your posture. And then last, if we find a problem we think we can help, we'll take an x-ray. And an x-ray will tell us and show us how things are misaligned, how the global spinal architecture looks, meaning are there any curves, are there any congenital changes to your spine which would make us wary of adjusting you in a certain area. They'll show us how things are misaligned, and they'll also show us how long you've had the problem by showing us if there's any wear and tear arthritis. So it gives us a real good history of what is going on inside. As we talk to you and listen to your story, we're going to also find out what are your health concerns, what are your symptoms, what are your goals. We put all this information together about how your nervous system is dealing with stress, where there may be interference in the flow of your body's intelligence and healing, and ultimately, what is the root cause of your problem and your body signals, be that hip, knee, ankle, or foot issues. That's so we can correct the cause, not just treat the symptoms. After all, how can you correct the cause and get back to health if you never find out the root of the problem? So we do a report of findings to go over all of this with you, where we'll fully explain what we found and what our recommendations are for your care, and then we'll answer any questions that you might have about the process. Now we're able to do all of this in-house, and this process generally costs about $275 to $325. That's in our office. Can you imagine what this would cost in a medical doctor's office? Probably a lot more. And maybe that's why we have a $2 trillion healthcare burden. But enough of that. Anyway, how can you find out about all this for yourself? Before we get to how you can get a specific checkup, I just wanted to clarify a little bit where the most common problems are in people who have hip, knee, and ankle problems. So the lower lumbar spine from L3 to L5, those are the nerves that make up the bulk of the sciatic nerve. And they also innervate the hips, and the knees, and the ankles. Also the sacrum or the sacroiliac joint, the bones of your pelvis that connect to the sacrum. When those misalign, they can cause shortening or lengthening of the legs. They can cause pronation down in the feet. They can cause valgus stress or varus stress on the knee. All kinds of issues that you have to compensate for, leading to some of the most common lower extremity injuries that we talked about already. So again, in our process, those would be the areas. So there's really 3 steps to correcting the cause of these issues. One is trying to break bad habits. Again, are you training poorly? Are you wearing poor shoes? The other would be addressing weaknesses or muscle tightness or imbalances. You do that by adding specific exercises and stretching. Getting back to number 1, bad habits. Some of these things we can't help. If we have to drive to work, we have to sit. But we can stand at work, if possible, by using a stand-up desk to take pressure off our lower back and our hips. We can stand up while we eat if we have to sit a lot at work as well, to reduce that stress on the lower back and the hips. And last but certainly not least are chiropractic adjustments. If you're subluxated, the only way to correct these problems is with number 3, specific chiropractic adjustments. And only a chiropractor is trained to find and correct subluxations. So don't be thinking that your medical doctor or even your physical therapist is going to refer you for a chiropractic adjustment. One, they just don't do that, so they're not going to know whether or not you have subluxations. The art and the science of chiropractic, it's highly specific, particularly the method that I do, which is called the Gonstead method. It's a very gentle technique, but it's very specific to correcting the subluxation. We utilize all kinds of exam procedures, instrumentation, and x-rays to help figure out where the subluxations are and how to best realign and return normal motion and function to your spine. This will help to reduce stress and interference to the nervous system. It normalizes nervous system input and communication, which results in your body working the way it's supposed to. It's safe, it's effective, and it's now the largest drug-free approach to healing in the world. Millions of people get adjusted every day and have been doing so for over 100 years. Success story. Well, I've already told you my story. I think that was quite a success. As a high schooler, being one of the top tennis players in the state and having sciatic pain going all the way down my leg, and in just a few weeks with chiropractic adjustments, I was mostly relieved and I was able to continue to play and go on and compete in the state tennis tournament. But after 28 years of doing this, I can tell you that there are hundreds, if not thousands, of stories just like mine. I've been working with runners, and particularly the Fox River Trail runners, for the last 25 years. And I can't tell you how many people have come to me, sometimes 2 weeks before a marathon, with foot or ankle pain, or pain in their back or their hips, and not able to complete their last 20-mile runs, and worried that I put in 4 months to 5 months of training, and now they're not going to be able to even make it to the starting line. Many of these Yes, so as I said, procrastination, it's probably the #1 reason for our health crisis. It's said that procrastination is the enemy of success, and as a doctor, I can tell you I agree 100%. The most familiar but 5 most dangerous words I hear on a regular basis in my clinic is maybe it'll just go away. How many of you listening here today have tried to ignore their way out of a problem in the past? How did that work out for you? Did the problem get worse or did it get worse? After all, issues only get more difficult and harder to solve the longer we wait. So I'm not going to really let you do that. I'm not going to let procrastination get in the way of you getting healthy. I'm going to take it off the table and I'm going to reward the action takers. I'm going to make an offer to those of you that are willing to act today. You have to call my office today, 630-232-6400. Tell them that you watched Falling Apart Syndrome, Lower Extremity Issues online. You must call before July 31st and tell them you want to schedule your evaluation to see if we can help your hip, knee, ankle, foot, or lower back problem. Or if you're a runner or someone who really cares about their health and you just want to make sure that your biomechanics are really good so you don't get an injury, well, I commend you even more for taking action and not waiting till your symptoms tell you that something is wrong. At any rate, as I described earlier, the process of a full consultation where we talk about your problems, what's bothering you, what your goals are. We'll do a full spinal examination. We'll do a gait analysis. We'll look at your ankles, knees, hips, and spine. We'll do orthopedic tests and neurologic tests, and we'll even take 2 x-rays. This process normally costs up to $325. If you call us before July 31st, I'm willing to give you that for $49. But you have to call and schedule that appointment before July 31st. No exceptions, and you must mention when you schedule that you watch this workshop online. I hope you enjoyed this workshop, and please pass on to others this information because many, many people are suffering from all kinds of lower extremity injuries. Okay, I don't want you to be one of the statistics of the 79% of runners that are injured in a year. I also don't want you to be part of our current health crisis and be one of those people that procrastinate. So if you want to take advantage of this offer and find out what might be causing your pain or try to prevent these things from occurring, call the number on the screen above, 232-6400, before July 31st to get your discount evaluation. Have a great day, Dr. Ginsberg.